Hi, my name is Dr. Stephen Goldstein, and I'm speaking to you from the New York University Grossman School of Medicine, and this is another in our series of reducing the confusion in gynecology. What I'd like to speak to you about now, briefly, are what I call incidental findings in gynecologic ultrasound. This is a real problem. I wrote the second book ever on transvaginal ultrasound and spent much of the last 2.5 decades teaching OBGYNs in this country how to do vaginal probe ultrasound. The problem is, as more vaginal sonograms are ordered, more and more things that are actually variants of normal are discovered, and I find that there is much too much unnecessary anxiety, unnecessary further testing, and even, unfortunately, unnecessary surgery for things that are obviously benign. And when I examine patients with ultrasound, which I do on a relatively routine basis, if they have anything that I consider to be an incidental finding, I'm sure to show it to them on the screen and to warn them that if they ever have an imaging study for another reason, a good example, a patient of mine once was on vacation, had some pain, went to a local community hospital. They thought she might be having a kidney stone. So as quickly as they do a urinalysis, they did a CT scan of the abdomen and pelvis. Well, she didn't have a kidney stone, but she had a small fibroid that was barely still attached to the uterus. And the report came back possibly a fibroid, although ovarian malignancy could not be excluded. And she got operated on. Now, some patients would say, well, that's great, it was benign. I would say if they recognized it, it did not need to be done. The number of women that have benign fibroids, which we can be sure are benign based on their appearance and their typical blood flow characteristics on what's called color Doppler ultrasound, is staggering. As many as 17% of postmenopausal women will have a simple cyst on an ovary. And these are not precancerous. Unlike other organ systems like the cervix with its dysplasia, or the breast with its carcinoma in situ, or the uterine lining with its hyperplasias, benign ovarian growths don't transform into malignancy. As many as 13% of postmenopausal women will have a benign endometrial polyp that hasn't bled, sometimes in decades. 13%, that's 1 out of 8 women. There was a large Italian multi-center trial. They took out 1,153 polyps in a row in women who had not bled. There was 1 cancer in those polyps. And yet the incidence of complications from removing them approached almost 4%. There are numerous examples where the sensitivity of the ultrasound is so great. I coined a phrase called sonomicroscopy in my first book, because it's like we're doing our ultrasound through a low power microscope. We are seeing things with ultrasound that you could not see with your naked eye if you could hold the structure in your hand at arm's length and squint at it. So the beauty of the transvaginal ultrasound is the resolution, how much we can see, but the problem is, do we see too much? You must understand the difference between findings that are common, 17% of women with a cyst, 13% of women with a benign polyp, versus things that might truly be ominous. You know the way miniature trains look just like trains? I have discovered ovarian cancers that were tiny, but they looked like cancers. So be careful. If you have an ultrasound done of your pelvis and there are incidental findings, make sure that you are not overly tested or, even worse, operated on. Thank you.